Dr. Sparks, thank you for seeing me on such short notice. Yes, what brings you in today? Well, I've been experiencing some weird things for a couple months now. It started about a month after my brother passed away. What kind of weird things are you referring to? Can you describe them to me? I've been seeing things, hearing things, particularly my brother. I see him in the corner of my room when I'm trying to study or before bed, and I hear him sometimes. He tells me horrible things, that I was a bad sister, that I'm the reason he died in the car crash, and I know these things aren't true, that he would never say that. But I can't shake these images in his voice. I find myself staring away and talking to him even when I'm with people. I'm really emotional lately and make erratic decisions. I've never acted like this before. Sometimes even my ability to talk is hindered, and I don't understand. I see my brother everywhere and it's getting worse. Am I going crazy, doctor? No, you're not going crazy. Could you elaborate a bit more for me about these voices and visions? Have you been under the influence of alcohol or any recreational drugs while these have been occurring? No, doctor, I swear I haven't. Well, I noticed the first one on this 1-month anniversary. I was in my room up late studying for an exam when I heard him say my name. I looked around the room, but I didn't see anything. I figured I was just tired and hearing things, but a couple of minutes later I heard him again. He told me I was going to fail my exam like I had failed him. I was scared, so I called my friend to sleep over. I thought it would stop when my friend came, but I kept hearing him. It felt like he was in the room with us. My friend didn't hear anything, but I couldn't sleep that night. I stayed up through my exam and then crashed afterwards. I didn't hear him again for a week, before my next exam. He told me the same thing he had the time before, but he was louder. 3 weeks later, I saw him. I had been sleeping at my friend's place because I thought something was just weird in my room, I don't know. But as I was falling asleep on my friend's couch, I saw him staring at me from the corner of the room. He kept telling me I killed him, and then he told me I was worthless, and that I would fail. How long has this been occurring? About 8 weeks since I first heard him. Is there a history of something like this occurring in your family? Have you heard of anyone else experience symptoms similar to yours? Well, not in my parents or my siblings, no, so not in my immediate family. But my grandpa stopped taking his oxygen and died a couple of years ago. He said my grandma was calling him. He told us a couple of days before he died that he had been hearing Jesus and his wife telling him to kill himself and join them. We just thought he was senile and missed our grandma. And is there any other history of mental illness in your family? I mean, I have a cousin who's bipolar, but they're just like a first cousin, not like my sister or something. And you never experienced anything like this prior to, you said, about 8 weeks ago? No. Okay. It sounds to me like you might be experiencing schizophrenic episodes. Are you familiar with these? No. Could you tell me about it, please? Well, of course. Schizophrenia is a type of psychosis, like depression and bipolar affective disorder, which indicates a loss of touch with reality. It typically manifests between the ages of 15 and 45, more commonly between 20 and 30, like you. Symptoms relate to thoughts, perceptions, emotions, and volition. Symptoms are classified as being either positive, too much dopamine release, or negative, too little dopamine release. From what you've told me, it sounds like you're experiencing more of the positive signs, dominated in acute schizophrenia. You have increased brain activity. You're experiencing delusions, hallucinations, disorganized speech, and a behavior disturbance. Why does this happen? Well, the pathogenesis is not fully understood yet. It's partially genetic predisposition, but we can't be sure what exactly the cause is. A classical hypothesis is an excessive dopamine release in the accumbens, that this is the cause of the positive symptoms. Well, how do I treat this? What do I do? Well, as your physician, I can't accurately determine this for you, so I'll be referring you to our psychiatrist. However, schizophrenia is treated with neuroleptic drugs that can help you without sedating you. These work by causing an indifference to environment, inhibiting psychic excitation, and reducing inner tensions, drive, and anxiety. Basically, we distance patients from their psychosis and help them realize that they are ill. The full therapeutic effects of these drugs can take up to 10 weeks. So, how do these neuroleptics work? There are two classes of neuroleptics, classical and atypical. In classical, they have a dominant antagonistic effect on dopamine receptors, but they can cause dyskinesias, which are movement disorders. Atypical have a dominant antagonistic effect on serotonin receptors and are less likely to cause dyskinesias. Antipsychotic drugs usually follow their own general guidelines, but drugs can have different effects in each patient, so the psychiatrist will determine which treatment is best for you. I believe, given your symptoms are more positive than negative, a classical type drug will be given to you. Well, are there bad side effects? Like, what's going to happen to me? Side effects are different in everyone and will also depend on the drug you take, but there are some serious side effects associated with neuroleptics. They can cause hepatic damage, different dyskinesias, as mentioned before, and malignant neuroleptic syndrome. Wow, these sound really bad. While these effects are pretty serious, your psychiatrist will try and prescribe you the best drug possible, and if severe side effects occur with that drug, there are other drug treatments that they can try, and possibly a different class of drugs altogether. Thank you so much for your help, Dr. Sparks, but this sounds really scary. I mean, I have midterms coming up, I have a job, I don't know if I can deal with all this stress, and then schizophrenia on top of that? Well, you're seeking help, and that's the first step to any kind of recovery. I'll make sure you get in to see our psychiatrist as soon as possible. From there, you'll start new prescriptions and we should see improvement with that over time. However, I'm going to make a personal recommendation as well. I would like it if you visited the counseling services available here. I'm sure the psychiatrist will recommend it as well. This is a tough time in your life with school, work, and with the recent loss of your brother. I know you're very busy and you might not think you have enough time to see a therapist on top of that, but I truly believe it is in your best interest. After all, pharmacological treatment is only responsible for about a third of your recovery. Another third comes from family and friend support, which it sounds like you have, and the last third comes from seeing a professional. The grieving process is an especially difficult one, and you should not feel like you're in it alone. Thank you again, Doctor.